Name is Norm Volsky, your host.
Phenomenal hires that you've helped place, because that's the other thing. Like when it comes to enterprise
And
sales,
this is the
you've
Digital
It's
Health
an
Heavyweights
honor to
podcast.
be here, and it's been fun to work with you over the years.
We watch our dollars, but people win with us, and that's important.
Hello, and welcome back to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by the founder and CEO of Berry Street, Noah Kotlove.
Thanks so much for having me, Norm. I have to admit, I'm exposing myself. I've only listened via audio. I wasn't ready to see the boxing gloves, so that threw me for a loop.
It's a very friendly podcast, but we are fighting rising healthcare costs. So we're all on the same team.
I love it.
Yeah. So for all of our viewers and listeners, that are not as familiar with Noah, Noah is founder and CEO of Berry Street. Berry Street is on a mission to transform how Americans eat through nutrition therapy by connecting individuals needing evidence-based nutrition care with dietitians and AI addressing 25 plus conditions. Berry Street has raised $50 million in 2025 and is very passionate about diet behavior change. Previously, Noah was a senior innovation consultant at Accenture, as well as the founder of Sobriety. Noah holds a bachelor's in economics from the Wharton School at UPenn, and we could not be more excited to have him on the podcast. So Noah, welcome.
Thank you. Excited to join you.
Yeah, we're big fans of healthy eating and nutrition. We talk about that a lot on this podcast. We also have a video series called The Healthy Headhunters, where we cook some healthy meals weekly, sometimes monthly. So we're big fans of what you're doing. So Noah, what inspired you to get into the healthcare field?
Yeah, mine is very much like a patient-centric journey. And it's funny because I actually grew up in a healthcare household. My mom was a nurse. My dad was an
Same with me.
oncologist. It's the moms with the moms as nurses, I think is definitely a commonality I see in folks in the healthcare space. But yeah, mom's an RN, dad was an oncologist, and I thought I'm not interested in healthcare at all, and kind of took my entrepreneurial journey. But as a patient myself, like so many Americans, I really struggled with my diet pretty much my entire life, even as a little kid. Kind of a classic American, like 90s household, would get home from
Mhm.
school, two working parents, unfettered access to a pantry full of, all of the most processed foods that, would make RFK's head spin. And I just learned so many terrible eating habits that continued into my adulthood. And so in my 20s, as I'm, kind of starting my entrepreneurial career, I'm just struggling more and more, gaining weight, and increasingly as I got older, experiencing all sorts of chronic conditions that were, kind of odd for a man of my age. And around the time I turned 30, I was at my absolute heaviest. I think a lot of Americans can relate to this. I don't even really know exactly how heavy I was because I stopped stepping on the scale. It's like, I didn't want to see that number. And I was feeling my lowest, spiritually. And I saw a doctor for an annual physical. And just like every other doctor I had ever seen, he told me, you really got to lose weight, which again, a lot of folks hear that when they go to the PCP, not usually particularly helpful, right? It's like, yeah, doc, like I know that. Trust me, I'm trying. But this doctor actually had a solution. He said, you should try seeing a dietitian. I've heard it's covered by insurance. And I left that visit thinking, that's kind of odd. Like, I know what the healthy foods are. I don't think a dietitian is going to help me here, but maybe I'll try it out. And so I tried it, and instantly, or practically instantly, I should say, I realized how much of a misconception I had about what this care was going to be like. I thought it would be really kind of, surface level, eat this, don't eat that. But working with a dietitian goes so much deeper than that.
Mhm.
You really get into your relationship with food. And, whether folks realize it or not, I think most don't. We all have a very specific personal emotional relationship with food,
Yeah.
and unfortunately, in this country, for most people, I would say that relationship is tends to be a toxic one. And
Mhm.
so over many weeks working with my dietitian to first just like understand that relationship with food, and then start to unpack it and build it back, I learned small tips and tricks, also bigger changes to make in my life. And I ultimately ended up losing about 60, 65 pounds over the course of that journey with my dietitian. And as crazy as it sounds today, this was like relatively easy after
Yeah.
decades of struggling with all sorts of crazy crash diets with, tons of restrictions. It was these small, consistent changes that ended up really making the difference and compounding because I could stick with them. So, had this life-changing healthcare journey,
Yeah.
which was amazing in and of itself. But the entrepreneur in me was fascinated by the insurance coverage because it blew my mind.
Hmm.
I was self-employed at the time, so I had a Obamacare exchange plan, really high deductible. I often tell people like it felt like I couldn't sneeze near an urgent care facility without getting a hefty bill in the mail.
Hmm.
And lo and behold, these EOBs would show up in my mail after these dietitian visits, and after all the crazy insurance math at the top, at the bottom, every time your out-of-pocket cost $0. And after three or four of these $0 EOBs came in the mail, I started kind of thinking like, what the heck is going on here? The doctor said it would be covered. I didn't think it was going to be free. Like this is
Yeah.
crazy. There must be some kind of mistake. So I ended up, starting to pull at that thread and quickly learned, oh, there's actually no mistake here at all. Most commercial plans have really generous coverage to work with a dietitian because it's considered preventative care. So the next question to me was, why is nobody using this? Why is nobody even talking about this? I, barely knew what a dietitian did. I certainly didn't know it was free. Here's this benefit that so many Americans could benefit from, whether they're looking to lose weight, like I was. And of course, we're battling an obesity epidemic in this country, but nutrition is relevant for, reasons far beyond weight loss, right? It touches every condition, both chronic and acute. And even for people who are generally well, there's lots of reasons you might want to improve your nutrition. So that sent me on this journey, and quickly learned that on the patient side, really low awareness of the coverage and really, this form of care, just like, I experienced. And then on the dietitian side, lots of barriers to entry to dietitians even being able to deliver this care in the first place.
Hmm.
And so that's really where Berry Street was born, was to connect patients with dietitians who accept their insurance, who specialize in whatever they need help with, who are licensed in their geography, and then giving them the tools to treat the patients virtually, and then support them largely with AI functionality to extend the impact of the dietitian between sessions.
That's fantastic. What are some of the like main overarching principles that helped you personally lose, 60 pounds? And I'm sure that was a cascading effect of like higher energy levels, feeling better.
Yeah, absolutely. I mean, you probably won't be shocked to hear, but magically or seemingly magically, all of a sudden, a lot of these chronic conditions that I was struggling with started to, kind of fall by the wayside. But one thing I should emphasize before getting into like my specific story is each patient's journey is different. And, I think one of the principles at Berry Street that we really live by is there's no one size fits all to care. So whatever
Yeah.
worked for me doesn't necessarily work for other patients. And so we put a lot of blood, sweat, and tears into, you know, matching that patient with the dietitian who we believe is going to, give them the best chance of success. And then again, my journey was a weight loss journey, but we have plenty of patients who are seeing their dietitian for all sorts of other reasons. We have oncological dietitians, we have eating disorder dietitians, et cetera. But for me, it was a few things. One, this is going to sound really simple, but it's one of those things that straightforward but difficult to practice, which is just like mindful eating, dietitians call it, right? So just thinking a little bit about what you're eating before you eat it, right? And why am I eating? Am I going for this snack in the middle of the night because I'm actually hungry, or am I stressed? Am I anxious? Just really trying to put that little bit of thought behind, why you're reaching for a particular food. This is going to sound kind of counterintuitive, but dietitians often talk a lot about this concept of food freedom. And this was a big one for me because I think something a lot of folks struggle with, and there's actually some parallels to my work in the world of sobriety. But sometimes when people fall off the wagon, then it's like, oh, I give up. I screwed up, and life is hope. There's no point in trying to get back on the wagon, right? So if you demonize something like pizza, right? Then you have a slice of pizza, and then the next thing you know, you took down maybe a whole pie
Yeah.
because sort of what's the point? I screwed up my diet. Now I'm starting from zero again. So dietitians can really be helpful in helping patients kind of release some of that and find that food freedom where, it's like there's no bad foods. Enjoy the hell out of that. I don't know if I can swear on this podcast, by the way,
Yes,
but
no, encouraged actually.
my mother would be ashamed. But enjoy the hell out of that slice of pizza, and do it mindfully and say, I'm gonna, I'm maybe there's a pizza party at work, but I'm gonna have this slice of pizza or maybe two, and it's not gonna cause me to, slide into a weekend of, debauchery, and sort of letting go of that guilt was really impactful for me. And then there's little tactics, right? I'm very much a snacker and I'm an anxious snacker. And something as simple as, hey, if you're gonna have a snack, pour it into a bowl instead of eating it straight out of the bag, to just, give yourself that moment of pause to say, okay, after I finish this, bowl of pretzels, do I want to almost like opt in again, right? Do I want to pour myself another portion of
Yeah.
pretzels, or does that moment give me the chance to say, you know what, actually, I'm okay now. I'm going to stop. It's almost putting some guardrails in place to set yourself up for success, and that made a huge difference for me.
Yeah, and I think, I've watched almost every documentary around eating and obesity and, everything that's been out there. And again, like we are in a country where we are constantly reminded and marketed to, and it tends to be the high margin, foods that tend to be unhealthy, that
Hmm.
make companies like Frito-Lay and, other large food distributors and food manufacturers, extremely wealthy companies. So again, it's almost as if like our current society is conspiring against us, to live these healthy lives. So again, anyone struggling, it's not because there's something wrong with you. It's more like there's something wrong with this country and how they are willing to do what's best for corporations and not what's in the best interest of individuals. So walk us through your experience in founding, Sobriety Soft. Number one, it was like your first entrepreneurial journey. And second, I would also say that falls into the healthcare sector as well.
Yeah, it's funny because I didn't really think of it as a healthcare journey at the time, but it ends up informing a lot of the work that I do
Hmm.
now, 10 plus years later. This was slightly less personal, but still quite personal. So I was, pretty much fresh out of college at the time. This wasn't the earliest days of the App Store, but this was pretty early. The App Store functioned a lot differently back then than it does now. I'm gonna age myself, but these were the days where in-app purchases didn't exist. If the typical monetization scheme was paid apps. And so a close family member of mine, as I was growing up, was a recovered alcoholic, was in AA and was very vocal about it. And so I was very familiar with the culture and community of Alcoholics Anonymous and, other 12-step programs. And this particular family member, I was visiting home over a holiday, and they shared, there's like no good apps for people, apps. This was when people were really starting to talk a lot about
Yeah.
apps. There's no good apps for this community, and there's not, a good digital resource. And so I heard that and thought, oh, that's kind of interesting. Like, let me dig in here. And so I poured over the App Store and noticed that, yeah, this person was right. There were really one just very low quality apps targeting this community, but that were doing quite well. Again, in this era of the App Store, you could tell how well certain apps were performing by they had these like top charts, and so there were a ton of you know Alcoholics Anonymous and other sobriety oriented apps that were charging folks, that were charting really well in certain categories, but there were no free apps. And I thought that was quite odd, especially because it's funny. It's very similar to the Bible in a lot of ways. So there's a book that's sort of from which all 12 step programs have spawned,
Yeah.
called The Big Book, written by Bill W. It's an amazing book to read, whether you're interested in, getting sober or not. To be clear, not living sober. But again, like a ton of, respect and admiration for that community. Anyway, so this book, just like the Bible, is in the public domain. Yet all of these, very thin apps were essentially just putting that book inside an app container and charging whatever,
Mhm.
4.99, 5.99, 6.99 for it. And so I thought, well, that's unfair. This is public domain content. I can make this free and I can, find other ways of driving value and monetize that way. I don't know exactly how I'm going to do that yet, but let me start there. And so I had the first free app targeting this community. And, the power of free, I would come to learn later on in Berry Street is very meaningful. And so within a matter of days, it started to chart really highly. And then ultimately, I was able to find more creative ways to drive more value to those, to that user base and
Hmm.
monetize that way. One of the kind of core principles of that business that served us really well was, especially given the sensitivity of this community, like we have to drive value for free, and we're
Hmm.
certainly not going to extract value from anything that, we're not special at driving, right? So public domain content, most of all, there's no reason that we should be monetizing that way because, this is free for everyone to access.
Yep, absolutely. What were some of your greatest learnings and challenges at Sobriety Soft?
Yeah. I mean, the biggest challenge throughout that journey was the sensitivity of that community. I mean, folks in recovery, it's a very sensitive, vulnerable audience as it is. And then, we weren't affiliated with Alcoholics Anonymous, right? That's a kind of an amazing grassroots organization. Of course, it's a nonprofit. So we had to tread very lightly in areas where we were a for-profit business. So we did need to monetize, but walking that line was challenging. And we were always, you know, exercising an abundance of caution, but the audience would certainly let us know whenever we crossed that line. And so that really taught me to, it sounds trite in startup world, but like, remain close to your users, right? And
Yep.
build relationships and trust with them, of course, so you can, get their feedback. But I think the more kind of nuanced reason that's important
Hmm.
is you really start, I think, to be able to have be able to predict how they're going to feel about things, so then you're crossing that line less frequently. So that was a challenge throughout our lifetime, but it also taught me a lot of really valuable lessons about how to care for a user base in a community.
Yeah, so you ran the most popular app for Alcoholics Anonymous on both Apple Store and the Android Store. How did that build the foundation for what you're doing today?
One was just sort of this sort of starting small, like, right, starting with like a really kind of a kernel of an idea and building out from there, right? Like,
Yep.
Rome wasn't built in a day,
Hmm.
or keep it simple, stupid is something I try to live by.
Hmm.
And so starting with that small kernel and building out from there ended up working in that case, and I think I've followed that pattern in my ventures since then, including Berry Street, right? Like we really in the early days of Berry Street were maniacally focused on the visit between the patient and the dietitian. That's the product. And so anything that's not in service of that visit happening and that visit being as effective and enjoyable as possible is not worth doing in the early days. Right now we have more resources, we understand the space better, we can we have the freedom and the ability to do a lot more. But that laser focus early on, it's served us really well. I chat with maybe like less experienced, younger, earlier career founders all the time. And so a pattern I see a lot is this sort of, their eyes are bigger than their stomach almost, right? They are so excited about what they're building and they can see so far ahead of what they want to do. But they pull too much of that forward and almost editing what you want to do to its, to its simplest form. I found that recipe is often, a successful one.
Yeah, and how did your experience at Accenture, again, prepare you better for being CEO and founder now?
Yeah, I'm smiling because honestly, it was a really amazing experience to work at a big company like Accenture. And ultimately, because I had started my first company so early in my career, I had never really been, I had worked for a few early stage companies right out of college, but early stage companies are a much different beast. I had never really worked at a quote unquote like real company. And after a COVID kind of era venture hadn't gone as I had hoped, I thought, I've never tried this like big company thing. I'm really
Hmm.
interested to try it. And I was very fortunate to end up getting hired by a pretty boutique group within Accenture that does essentially like startup consulting for Fortune 100 companies. So
Very
embedding
cool.
within teams at those kinds of enterprises and helping them really like build the muscle of coming up with new ideas, validating them leanly, like
Hmm.
exercising a lot of the ultimate like lean startup principles.
Gotcha.
But what that experience taught me more so than anything was, how do I say this? Almost like the invincibility of startups. When you're old, when you spend your entire career in the startup world, sometimes I think, hold some kind of, whether it's fear or, healthy respect for like large enterprise, right? It feels like large enterprises could quite easily replicate what you're doing and ultimately, upend you. But what I learned from working, kind of embedding in those teams is actually, the things that make those teams incredible at operating large scale businesses actually very much prevent them from being successful at
Yeah,
that sort
hamstrings
of
them
zero.
on
Yeah.
innovation.
Exactly. And so it gave me, I think, if anything, a lot more confidence as an entrepreneur and operator, but also that this idea that startups will always exist
Yes.
because you have to have that sort of magical alchemy of, some combination of, naive fearlessness, what have you, to be able to tackle, sort of new problems and attack problems, from different perspectives. And so ultimately this cycle of, ambitious entrepreneurs starting, companies in particular problem spaces and ultimately getting, in most best case scenarios, acquired by some of these large enterprises. Like that cycle will never end
Yep.
because those large enterprises, whether they realize it or not, are actually almost like by definition not able to solve problems in that same way.
And Berry Street, great name. What inspired the name?
Yeah, I wish I had a better story for this, but we started the company on Berry Street I live in Brooklyn. So Williamsburg in Brooklyn has a Berry Street. And so I think this is somewhat of a classic startup tale of we used it as a placeholder and then, all these years later, have never changed it.
Yep.
But we liked it for obvious reasons, right? Berry connotes health, as well as Berry Street's it sounds like a street that exists in every town
Anywhere.
in America.
Yes.
And so we thought, oh, it'll make this virtual practice feel kind of local. And it never ceases to amaze me how much I'll meet people from different cities, especially the venture capitalists in San Francisco, and they'll say, "Oh, like like Berry Street in San Francisco, or Berry Street here or there." It's like, yeah, sure, yeah, wherever, it's in the
Super
eye of the beholder.
familiar.
Yeah.
It's actually interesting that one of my favorite bands of all time was unnamed for a while, and they were playing a lot with Bob Dylan in the 60s. And around Woodstock, New York, they were just the band. Like, oh yeah, that's the band, like the local band. And then like eventually when they had to finally like name themselves for their first album, they just called themselves the band. And they became very popular and they had the Last Waltz in the 70s that Martin Scorsese directed that, still watch to this day. And it's funny how some of those things work.
You just gave me a new fun fact to delight my dad with as a huge classic rock fan. I've never
Oh
heard that story of
man.
the band's origin. Yeah.
For anyone who hasn't heard of them, please do yourself a favor and just listen to their like greatest hits album. Unbelievable. So good. So anyways, how is nutrition counseling the most underutilized benefit in all of the American healthcare system?
Yeah, I mean, for starters, the majority of Americans have access to this care. Again, our roots are in commercial. So on most commercial plans, this is a covered benefit both as preventative care and medical care. So about roughly two-thirds of Americans are on commercial, health plans. And then even on Medicare and Medicaid, the coverage is more limited, but there is coverage for conditions like diabetes, in some cases pre-diabetes, chronic kidney disease. And so there are a ton of Americans who have access to this care in some shape or form. And then, like I stressed earlier, it's universally relevant, whether you're, battling chronic obesity, whether you're, struggling with, chronic conditions like polycystic ovarian syndrome, whether you're suffering from an eating disorder, whether you're struggling with your sleep, food is upstream of all how we're feeling every day, good, bad, and ugly. And so that combination of the access that people have this coverage to see a dietitian, almost always for free, but if not for free, at a really low cost, and then the relevance makes it almost shamefully underutilized to this point.
This episode was brought to you by the digital health team at Direct Recruiters, as well as the MVP Growth Partners team. We are really excited on the Direct Recruiters side to work with companies including Livongo, Teladoc, Hinge Health, Lyra, Verta, Progeny, Carum, Rightway, and many other great companies. From MVP Growth Partners, we're really excited to invest in early stage digital health companies. Our first is One Imaging, which we couldn't be more excited about, and Posterity being second, and many more to come. Thanks for watching and listening, and back to our episode. Yeah, and this year your team raised $50 million. What would you say to founders going out to raise right now? Because this is not an easy environment to raise funds.
Yeah, well, I guess it depends what kind of company you are, because for some companies, I think
If you have an
it's actually
AI solution,
yeah,
it's very easy to raise money. Correct.
yeah, and you know, in all seriousness, I would say one piece of advice is like I'm a big believer in AI. I'm definitely an AI optimist. And so I think you'd be borderline negligent as a founder if you don't have, a perspective on how AI is is going to be leveraged in your business. So we all have to have an AI story, I think, as table stakes these days. But beyond that, a big thing I think that I've learned over time is authenticity really is so valuable. If you're approaching, any sort of stakeholder, whether it's an investor, a customer, a partner, and you're doing so inauthentically, and you're putting on, some kind of air because, some other founder told you to act a certain way, act aloof, because investors will respond well to that. I've never found success in being anyone other than myself, and ultimately, maybe it'll take some more time than others to find that fit, but you're going to find, a fit of, investors who that authenticity resonates with. And so, when I do get a chance to advise founders who are earlier in their journey, that's something I really stress is, I'm going to give you a bunch of advice, but also put it through your lens, right? Because don't show up as me, show up as yourself.
I like that. And what justified that $50 million raise? Like, that's a huge number, shows a lot of investor confidence. Like, what was the success that allowed you to raise that? And then what are you using it for?
Yeah, a few things. One, we grew really fast. So we started in January 2023,
Mm-hmm.
and in just about 2 years, we scaled to several tens of millions in annualized revenue. We had attracted a large number of dietitians and patients. So that just rapid growth, in and of itself will attract a lot of attention, of course. We also did so very leanly. So I come from a bootstrap background. Berry Street's actually my first venture-backed company, and so a lot of that bootstrap DNA is ingrained within me. And so we were very resourceful, especially early on, to make a lot out of very little. And again, part of that was that kind of laser focus. But beyond just like the sheer lean growth that we achieved, of course, the market in and of itself is really big. Obesity is the obvious one to focus on, and that's a tremendous one. But beyond that, just nutrition in America is such a massive rat's nest of a problem. GLP-1s certainly helped. That became very much a tailwind for this entire space, and a big focus for investors. And then the other thing I would say that helped a lot was we're very provider obsessed. We, from day zero, really emphasized taking care of dietitians and, providing as much resources, value as we possibly can for them.
Mm-hmm.
And, investors certainly do their homework, and, we'll do expert calls and customer interviews. And, there's a lot that we still need to do better at. But one thing we're very confident in is that our dietitians and then ultimately our patients have great experiences and great things to say about Berry Street. And a lot of that comes down to, the care we put into their experiences with our company.
A lot of people in general just like use nutritionist and dietitian
Mm.
interchangeably. Can you give us your definition of like the difference between the two?
Yeah. If you've talked to any dietitian, this is a huge issue for them. Dietitians really do not like to be misclassified as nutritionists. So dietitian is a very clear credential, right? There's the Academy of Dietetics. This is a national governing body that dictates what it means to be a dietitian. And dietitians have to jump through a lot of hoops to
Yeah.
achieve that credential. They have to get bachelor's and master's degrees. They have to do a 2-year internship. They have to take their exam to become a dietitian, and they have to do lots of continuing education every 5 years to keep that credential. Dietitians have to go through all those hoops to be a true, medical
Certified
professional, a true
dietitian.
clinician, which is why they can bill insurance. Nutritionist means absolutely nothing. There's no, universally kind of accepted credential for nutritionist, right? So, you and I could decide today on this podcast that we're both nutritionists and we're starting the digital health heavyweights nutritionist company. And so this is a problem for dietitians because at some point in the, 20th, 21st century, nutritionist kind of became in vogue as a term. I always say like nutritionist sounds like something the Kardashians have, and dietitian sounds like something, our grandmothers had. And
Yeah.
so, the Academy of Dietetics actually in the past, I think, decade or so, changed the title or gave dietitians the option of changing the title from registered dietitian to registered dietitian nutritionist to try to combat some of this, I think, just sort of societal, view, I guess, as like which one has a better brand. But yeah, don't get it twisted. Dietitians are very different from nutritionists. I should also call out there are other credentials that are, that are equally valid. So we also work with a credential called CNS. So these are certified nutrition specialists. So we are primarily registered dietitians, but there's other credentials that carry similar, if not equal, heft. But nutritionist as a standalone term does not carry much at all.
Okay. Really, thank you for clarifying. Walk us through the patient experience of one of Berry Street's members.
Yeah, so if you go to berrystreet.com, you'll go through a really simple intake flow where we'll ask you, where are you located? What are you looking for help with? And, what your insurance is. Then, our intelligent kind of matching algorithm behind the scenes will surface the dietitians who we believe are going to be the best fit for you. You can sort through their profiles and ultimately decide on which dietitian you prefer to work with, find a time that works for you on their schedule. And then from there, we will verify your insurance. So for every single patient who's coming through Berry Street stores, the promise we make for them is we're going to tell you exactly what this is going to cost. You probably heard that from an advertisement from a friend or a family member that this is free. And so there's a high bar when when people expect something to be free. So we take a lot of burden on behalf of our patients to verify not just that they're eligible for the service, but what is their actual out-of-pocket cost going to be, if anything. The overwhelming majority of our patients pay $0 out of pocket, but some plans do require a small copay or, even smaller percentage of plans, unfortunately, don't cover this. So before your first appointment, we'll get back to you most of the time instantly, but for some patients, it can take slightly longer because we have to get in touch with their insurance company to verify that cost. And then you meet with your dietitian on our own virtual telehealth platform where the dietitian will, first get to know you, get to know what you're struggling with. And then from there, we leverage AI quite a bit to help the dietitian give you as many, sort of resources as possible. So the dietitian will develop a custom meal plan for you based on, of course, what you're looking to achieve in this work with them, but also, what your preferences are. If you mentioned in your session that you don't like, nuts, then, you rest assured your meal plan will certainly not include, any nut-based recipes. So that meal plan will include a shopping list, all of these assets that will, again, just increase the likelihood that you're going to be able to follow and adhere to these sort of these guidelines, ultimately like keep up these small behavior changes over time. And then depending on the recommendation of the dietitian, you'll meet weekly or bi-weekly for some set period of time, depending on the condition you're coming in with. We typically have a sort of defined clinical pathway that our clinical team has developed that they believe is the most efficacious for what you're working on.
And who is covered, and it is a completely free service. If you have which health plans is this completely free?
Yeah, generally speaking, by the way, as a relative newcomer to healthcare, one of my favorite terms is BUCA. Once I learned BUCA, I can't stop saying
Yeah.
BUCA. But, whether you're on one of the Blue Cross plans, United, Cigna, or Aetna, again, extreme. I'm painting with a broad brush, but most of those plans will have some amount of coverage, some more than others, but typically all quite generous. And then regional plans, not to count them out, typically do as well. It's really on the commercial side, the plans that don't have coverage for a dietitian, like it's usually that an employer, in their specific plan design, pulled it out for whatever reason. Broad strokes, 95% of plans, anyone can see the dietitian under that preventative coverage. So that doesn't require any diagnosis. It doesn't require a referral to get this care. Now, either
You
if
don't
you
need
don't
a
have
prior authorization to go seek
exactly
the
most of the time,
dietitian.
again, this is healthcare in the US, so there's always a million exceptions to the rule. And then if you don't have that preventative coverage, or if you run out of it, then most plans have medical coverage as well. Then you will need a diagnosis. Depending on the plan, some diagnoses will qualify for more visits, some won't. So for example, I have a very typical Aetna plan. I get 10 visits a year preventative, and then if I have a qualifying diagnosis, obesity, I actually qualify for 16 more. So 26 visits a year, which on a biweekly cadence is practically unlimited. And that we find is pretty typical.
Okay. Very, very good. And walk us through just the commercial go-to-market strategy. Like, how are you getting your patients in the door, and what type of customers have you been able to sell?
Yeah, it's evolved quite a bit over time, but it started very simply. So because this is already a covered benefit on most commercial plans, we didn't need to go pound the pavement selling to health plans or self-insured employers in order to get off the ground, right? We could actually go direct to patients and
Hmm.
say, hey, you have coverage for this care. Why don't you try it out, and ultimately leverage channels like Instagram and TikTok to do that quite effectively. And then on the
And
dietitian
what did
side,
you have to do to become an in-network
mm,
provider?
yep. So to solve that sort of 0 to 1 problem, we actually acquired an existing dietitian practice. So my teammate Marjorie Cohn was a successful private practice dietitian in the Philadelphia
Yeah.
area. And as I was doing my customer discovery in the early days, her and I really clicked and kind of saw this shared vision for where dietetics could be brought and how much opportunity there was being left on the table here. And so we acquired her practice to get some of those initial contracts, in-network contracts with health plans. But ultimately, again, because it's a covered benefit, we could continue to add more dietitians and just enroll individual providers. And ultimately, as that started to snowball and our group got bigger, we could enroll as a group, get group contracts, and ultimately, expand to national contracts eventually. And so on the dietitian side, being able to just enroll them, and on the patient side, being able to just treat them, as
Yeah.
simple as that sounds, was a very effective way to get started. And then now that we're at the scale that we've achieved in a few years, we're able to evolve beyond that kind of direct to consumer go to market to work more directly with the health plans, with employers, with TPAs to service their membership because this care is so cost effective.
Fantastic. And can you walk us through some clinical outcomes data? Like, do you have any statistics to show how Berry Street's helping the end patient?
Yeah, one of the challenges in our clinical outcomes is we are, again, not just, I sound like a broken record, but not just a weight loss company, right? We're a
Yeah.
nutrition company. And so we have really dozens of different kind of patient populations that we treat. Of course, weight loss is the obvious one. And so we actually just released some clinical outcomes data around our GLP-1 pathway program. And so this pathway program involves 3 paths. So there's patients who are looking to explore getting on a GLP-1 but not yet ready to make that leap, or maybe their health plan prevents them from accessing GLP-1 coverage until they, complete a program like this. Then, once patients are on the medications, giving them that nutritional support that they need. And
Yeah.
then lastly, sustain, we call it, which is the program to titrate off those drugs and sustain the benefits that you gain from them. And so as part of this program, we looked at the clinical outcomes data from our weight loss patients who were on GLP-1s and our patients who were exploring GLP-1s but not yet on them. And we found some pretty remarkable data. So my clinical team would kick me under the table if they heard me right now, because I don't have the data immediately in front of me. But roughly speaking, patients who stuck with the program for 6 months, who were on GLP-1s lost an average of about 24 pounds, and patients who were not on GLP-1s and stayed on the program for 6 months lost an average of about 17 pounds. And so, of course, a big difference between those two, but still, we're really proud of that outcome on the non-GLP-1 side. Not to say that one journey is better than the other. We're big supporters and believers of weight loss medications, but it just goes to show that patients can achieve great outcomes with or without the medication, and it really depends on their specific situation, which ends up being the best path for them.
With the explosion of GLP-1 availability, adoption, and now in the last couple of weeks, even affordability, how does Berry Street, kind of fit into this like cultural zeitgeist of GLP-1s, and what does it mean for the future of how this condition is handled going forward?
Yeah, it's funny, not so much anymore, but maybe a year or two ago, a lot of overzealous venture capitalists would say, hey, in a future where everyone's on these new drugs, who needs a dietitian, right? This problem is already solved. Why would I need this? But the reality couldn't be further from the truth. So a few thoughts. One, again, we are sort of medication agnostic, right? Some patients really benefit tremendously from these medications. Some patients really don't want to be on them for a variety of reasons, personal or rational, right? Maybe they try these medications and they're having adverse side effects that are just, too much to bear. And so for patients who either willfully or, for other reasons, just, do not want to take these drugs, dietitians are a proven, clinically cost-effective way to lose weight. But, more relevantly for this trend, like even if you're on the medications, it's really important that you have that nutritional support. So we've all read the stories of patients, losing lean muscle mass and some of these other side effects of these drugs. It's very unintuitive to be on these drugs because you're not particularly hungry. And so the problem there is patients, sometimes aren't eating enough, as kind of funny as that sounds. And then they're not eating enough of the vital nutrients that their body needs to thrive. And so a lot of our dietitians are experts in GLP-1s. Many of them were even, parts of some of these early clinical trials. And so there's a very specific way, you might need to eat to make sure you're getting your proteins and some of these other vital nutrients in that, sort of existence where you're not particularly hungry and you get full quite often. You also might be digesting certain foods differently than you did before you're on the medication. And then lastly, and this, is the optimist in me. I'm a founder, so of course I'm an optimist. I think it's really unfair and pejorative, this idea that Americans, kind of want the easy button, right? They want to be on drugs for the rest of their life. I'm a big believer that people want to live long, happy, healthy lives, and ideally they'd like to do so without being reliant on medications. And these medications are not easy to live on. They're truly like, technological breakthroughs, but they're not without their challenges. And so giving patients a path to get the most out of these medications, and then eventually a glide path off of them where they can, again, sustain those gains or the progress that they've made from the medication, but ultimately, build the behaviors that will serve them without the sort of medication preventing some of these bad behaviors.
Yeah, again, if you have a suppressed appetite, you can still eat like a Big Mac and a,
Yeah.
milkshake and still lose weight. Like, I don't know if that is a good long-term solve for someone's like long-term health journey, but like if you only have one goal and one goal in mind, like it is possible. So the way I look at it is GLP-1s are a tool, but they should not be a crutch. And I think when people are on GLP-1s, yes, it suppresses the appetite. Yes, it makes it easier for someone to have a lower caloric intake. But at the same time, if you are not getting coached in real time of, okay, there will be a reality in 6 months or 12 months or 18 months where you're off the drug. And like, that is no longer going to be the case where like you just have a suppressed appetite. How are you going to be able to maintain this new healthy weight that you eventually are going to be at? And how do you sustain that for decades, in the future? Because again, what I'm seeing from my lens is there are employers out there that are just saying, hey, we can't take the risk to cover this because we could be on the hook to cover it forever. And if that happens, like we're not going to be able to financially support that. And we're going to have to start raising premiums and co-pays and all things like a benefits department does not want to do. So a lot of them are just carving it out, saying, hey, like GLP-1s, we're not even touching it. If you want it, private pay, buy it yourself. Like we can't even, have it within the benefits design. So I think what Berry Street is doing is so crucial because it is preparing someone for life after being off the medication. And that is the key to long-term, like longevity and long-term health.
Well, absolutely. And something that people don't really talk that
It's
much
the
about, but is,
behavior change
yeah.
that needs to
Uh,
be ingrained, not necessarily just the number on the scale.
100%. But that kickstart is so we see it every day with some of our patients, right? If you're someone who's
100%.
been struggling with chronic obesity for your entire life, starting to see that number go down is a really powerful idea.
Yeah.
But something else some people don't talk a lot about is adherence is also a challenge because these drugs, have some unpleasant side effects. Sometimes patients don't stick on them long enough, and that's actually kind of the worst of all problems because it's an expense, maybe that the employer or the health plan bore. They didn't actually get the outcome, and
Result.
now the patient is kind of back to where they were before, and so
Or even
dietitians.
worse, because they lost some muscle mass,
Mm,
because they weren't eating properly, nutrition, as you said. Same thing with losing the weight too quickly and, not maintaining that. And then like their metabolism is even worse off, even at the same weight.
yeah.
So again, like there's just so many intricacies that you do need a clinician kind of looking over and monitoring to make sure you're setting yourself up for long-term health. And I don't want to come off as like the preachy, judgy person. I saw this with my own like father in his health journey. About 15 years ago, he got gastric bypass and he lost all this weight, and that was fantastic. But like he had heard the horror stories of
Hmm.
people that, got down within a year, 2 years, and then 5, 10 years later, they're right back up. And like their stomach expanded again. And like they might have had to get the surgery for a second time or just said, all right, well, maybe I'm helpless and this is my life now. Luckily, and, really proud of him, he noticed that like, hey, I can't just keep doing the same thing and expecting a different result. So, does he still eat some of his favorite foods and, definitely isn't like the picture of like a healthy diet necessarily, but like major improvements, much different portion sizes, and has really tried to prioritize like not acting like it's Super Bowl Sunday every day, and maybe being a little more choosy and picky, like when to have a splurge, so to speak. So again, I saw it, in my own parents' journey that yes, you can make a drastic change. You can get the quote unquote easy button, but it's how you react after, it's how you adapt after that, is really what's important.
Yeah, I love
Also,
that story, by the way, because you're right. It's not Super Bowl Sunday every day, but it is Super Bowl Sunday once a year, right? And so like that again, back to that idea of
or even
food
once a
freedom.
week.
Yeah, nobody's perfect, and having that ability to indulge and right, like life's short. We all have our favorite foods. We should be able to enjoy them, but of course, enjoy them in moderation, and the rest of the time try to keep up those good habits. But letting yourself off the hook every once in a while is also a really impactful idea.
I have a funny story because it happens to be timely. This is like when everyone gets their like holiday cards and holiday gifts out. And historically, my firm in the past always would send cookies to our clients' houses as like a thank you for like the business and the partnership. So obviously, me in health and wellness, like I have a very different customer base than a lot of my other partners. And one of my clients, Jim Pursley, the CCO of Livongo, one year calls me and goes, Norm, I really appreciate the gifts, but please no cookies this year. Like my wife said, I don't want them in the house. I don't want the kids to have them. Like just send a thank you card. I don't need the cookies. I'm like, all right, fine. And he said, but just know moderation, even in moderation. Occasionally, like,
Yeah.
do your thing. So, even, folks who are in the space, like, also acknowledge that, hey, when push comes to shove, no one's perfect. We're all human. And it's not about not falling off the horse. It's you just got to get up every time.
Yeah.
So I do
And
want to ask you, I ask every single person that comes on this podcast, I'm going to ask you a couple of things that are all personal and behavior based. We're all leaders in this space. I think it's important we practice what we preach. You're in a very stressful job. You're the CEO of a venture-backed startup that just got a big check, and with that comes big expectations. How do you de-stress, and how do you stay very centered in a very stressful environment?
A few things come to mind. One is, I live in New York City, and so whether I like it or not, I walk all the time.
Yep.
And also, my wife and I rescued a border collie mix about a year and a half ago.
Oh,
And
great.
again, whether we realize it or not, that dog needs a lot of walking. And so, I find, just going on long walks in the city is a great way to, just sort of relax and get your mind, uh, kind of operating in a different space. So that's a huge thing for me. My step count every day is usually pretty shocking if work's not terribly busy. And another one is kind of very relevant to everything we've been chatting about, but enjoying meals with my wife, enjoying meals with family, enjoying meals with friends, and really taking that time to, set the phone down and just enjoy the company and enjoy a hopefully healthy, but sometimes not meal amongst company that does not want to hear about business. And so I kind of get to turn that part of my brain off and chat about other topics, which often helps me come back to business with a renewed focus.
And another thing we want to, always encourage people to do is, try new things. And I think part of that is like in diet, like trying new recipes, trying new cuisines. So in your own health journey, are there any favorite recipes that you've, mastered over the years that help you, again, ward off cravings and at the same time you find them very flavorful, but also nourishing and makes you feel better?
Yeah, it's funny because I had listened to some episodes and knew this question was coming, but I didn't know about this healthy twist. So the recipe that I have in mind is not a particularly healthy one, but
That's
I'll give you a
okay. We
very
can make a version of it.
well, I'll give you a very, this is not quite a, it would be a stretch to call this a recipe.
Hmm.
But this is a like classic example of some of the less obvious learnings that, you'll get from working with a dietitian. I love bananas. I have eaten a banana like every morning for, as long as I can remember. Eating just a banana in the morning is a lot of fructose and not much else. And so my dietitian told me pair that banana with a spoonful of peanut butter, and you'll probably enjoy it more. But that combination of the fruit and some protein from the peanut butter among and some healthy fats will help you you'll feel fuller longer and have that sustained energy instead of
Satiety, I think, is
yeah,
the
exactly.
word. Yeah.
You took the word out of my mouth, and so without that sort of quick sugar rush and crash, and so I have a banana with some peanut butter every morning, and so again, a stretch to call that a recipe, but it makes a huge difference. That's like such a tiny change that ends up really helping me on my day to day. And then the recipe I was going to share with you is I thought it was a family recipe, but there's my mom has been cooking banana bread for as long as I can remember,
Awesome.
and her grandma before that, so sticking with the banana theme. And I thought it was this secret recipe that was passed down for generations. And I bought a bag of, I think it was like King Arthur flour a few years
And
ago,
it was the
and
same
was looking at,
recipe,
and it
like,
was the exact
okay.
same
Oh,
recipe. Yeah.
wow. I
So,
like it. Well, again, like there are healthy ways to make anything, and again, sometimes you want it just the way you was growing up, and there's nothing wrong with that either. So again, thank you so much. Interestingly enough, my wife eats at least two, sometimes three, rice cracker, peanut butter, and banana like
wow.
stacked open faced sandwiches as her like dessert. And it's powdered peanut butter, so like not the oil and fat,
Yeah.
but just like the taste. So she's a health nut, and that's like her, splurge, which I laugh because it's like probably one of the healthier things I would eat on a
I was
daily
gonna say that
basis.
sounds kind of like Elvis was famous for eating some version of that, but obviously a much more
Yeah,
unhealthy
yeah.
version. So that's Elvis would be spinning in his grave if he heard about this rice
That is
cracker
correct.
rendition.
My wife has been a very good influence on me when it comes to nutrition and health. So, anyways, really appreciate it, Noah, for joining us on the Digital Health Heavyweights podcast. Congrats on all your success and your team's success at Berry Street. And we could not be bigger fans. And we're wishing for a lot more success in the coming years. And we'd love to hear from how you're doing as the months and years go by. Take care.
Thanks so much for having me, Norm.
Thanks. Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.